First of all, what is DBS, or deep brain stimulation? Basically, deep means that it's not something that's on the surface of the brain, but an electrode is implanted into certain nucleus within the brain, and then a wire goes externally and is driven by a battery, pacemaker, which is identical in size and shape pretty much to a cardiac pacemaker, that's implanted just like a cardiac pacemaker into the patient's chest wall. And the pacemaker then supplies an electrical signal to stimulate that particular area of the brain. So how does it work? The pacemaker sends these mild electrical signals to an area in the brain that controls movement. And the areas in the brain that we're referring to are called basal ganglia. These are clusters of nerve cells that are deep in the brain and have an interactive function, specifically controlling movement. And where the electrode is placed doesn't necessarily is not necessarily in the same place where the disease exists. We know in Parkinson's disease, the nucleus that is most damaged is called the substantia nigra. The electrode placement to help patients with Parkinson's is placed in another nucleus nearby called the subthalamus. The signals then block some of the brain messages, and by doing so, act like the medications do to relieve some of the symptoms of both Parkinson's disease and essential tremor. So the patient then experiences better control over voluntary movements or relief of involuntary movements. Tremor is an involuntary movement that can be disabling. Rigidity prevents a voluntary movement when you're trying to do something, whether it's getting out of a chair or walking, or really any complex movement. And that's one of the main difficulties in patients with Parkinson's disease. So who can have it? Patients with essential tremor, patients with typical or idiopathic Parkinson's disease, which I'll explain in a moment, and then patients with dystonia, which I mentioned earlier is another type of movement disorder that's much less common. I should emphasize at this point that deep brain stimulation is not a cure for any of these entities. It's a treatment, it's an adjunct or replacement for medication, and it works in conjunction with medication. Patients who have deep brain stimulation for Parkinson's disease remain on some amount of medication, although in many cases it's lowered significantly, which helps get rid of some of the medication-related problems.